Hi, I'm Roslyn Rivera. I'm a pediatric cardiology nurse. I currently work at UCLA in Fetal Children's Hospital. I've been a nurse for about 17 years now, and I've always worked in pediatrics, specifically critical care, so in the pediatric ICU and with cardiology patients. So I have an extensive background in pediatric cardiology and pulmonology care. But with that, I would love to talk to you today about Camp del Corazon, which is one of the volunteer aspects of my nursing career. So Camp del Corazon is a nonprofit organization that provides summer camp and really year-round opportunities for children and families with congenital heart disease. They have a summer camp every summer where there are hundreds of children that come out. It's a medically safe camp, and most of the time these children are deemed a little bit too sick to attend a normal children's summer camp. So this is their opportunity to experience summer camp, riding in kayaks on the ocean and climbing rock walls and having those opportunities because it is medically safe. There are nurses and doctors there to help care for them. Camp del Corazon does offer year-round opportunities, including educational opportunities for families and events for the CHD community to get together. They also have a young adult program for young adults who are 18 to 25. It's called Progressive Adult Cardiac Experience, or PACE for short. We do sometimes monthly events. We have a virtual book club. We've had beach days. We've had movie nights. We also have an annual camping trip that's every October where we take these young adults camping in tents at campsites just to experience and learn new skills. So Camp del Corazon was started in 1995 by Dr. Kevin Shannon and his nurse, Lisa Knight at UCLA. And the reason they started this camp is because they had a patient who was a teenager who was really nervous about his procedures, really embarrassed about the scars he had from his heart surgeries. And he didn't know anyone else like him. And Dr. Shannon and Lisa Knight decided he needs to meet other kids like him. How can we do that? How can we facilitate that happening? And so they just created this camp. They decided we're going to have a small camp with some of our patients from UCLA, and we'll get them together and we'll go to a campsite and have a few days. And it was really bare bones and just kind of started from really small. And now we're serving nearly 450 children every year at summer camp. It was really their vision to provide a place for children who have complex heart conditions to be able to meet other kids like them and to not be nervous or anxious about going to the doctor, a place for them to really just be kids, because oftentimes they are in the hospital for like several months out of the year, have major surgery, and it's difficult for them to find a place where their families feel safe for them to do the activities that we do at camp, whether that's even just hiking around or swimming in the ocean. Sometimes we've had kids that have never even seen the ocean before come to camp and be able to swim in it. And it's really life-changing. And one of the best things about camp is the community. The children that attend make some of the best friends of their whole life, friends that they keep in touch with. We have counselors that were campers back in the early 90s. And so some of them are still best friends with the kids they met when they were 7, 8 years old in the mid 90s. Camp del Corazon has really created such a glorious community where kids with heart disease can really just share their experiences together. And it really goes into with the families as well. Camp really wants to offer support for families of these children because it can be distressing to have a child who is so sick. The fear of the unknown is a reality for these families. And so being able to provide this camp community is really provide a lot of hope for our families. There's always the camper who is crying at the dock as we're about to get them on a boat to separate them from their parents, and they don't want to leave and they don't want to go somewhere foreign. They don't know where they're going. And within a few hours, they're on the island with other kids their age running around laughing and have completely forgotten that they are missing home. And it's just the environment that camp really provides them with the activities that they may not necessarily have at home. You know, we have archery. Like none of these kids have ever held a bow and arrow before. I mean, I haven't until I went to camp as an adult, as a counselor, as a nurse. We have a saying at camp, it's challenge by choice. And that simply means we're going to present these new activities to you and challenges, and you can decide if you want to do them or not. And it can be as much as you're staring at the rock wall and you're terrified of getting up off the ground because you're maybe afraid of heights. So maybe the challenge for you this year is to just put on the harness and maybe just touch the wall. And next year, you can challenge yourself to do a little bit more, to actually climb that wall just a little bit and just see how far you can push yourself, knowing that we're here to support you. One thing that I tell my patients and their parents when they're in clinic, when I'm talking about camp, because I want all the kids to come, is I really just, I talk to the kid and I show them the pamphlet, I show them the video of what camp looks like, the activities we do. I explain how fun it is and how they're going to meet someone just like them. And then I look at the parent and I say, it's very medically safe. We have at minimum 2 doctors there at all times. They're pediatric cardiologists, and each cabin of campers has its own med nurse. And so that's about 1 med nurse for every 8 campers for the most part. And then there's also other counselors there. And a good portion of them, I'd say at least a third, do have some kind of medical background, whether that's an EMT paramedic, maybe they're a phlebotomist, they have some kind of medical background. And so that's extra eyes for us as the med team that is there in the island to make sure that we're keeping the campers safe and healthy. And then the medications, we administer them all the way that the parents and the doctors have prescribed them to be. And so we're definitely making sure that the kids that are there are keeping up with their medical regimen as well. That being said, definitely there to have fun. Camp del Corazon is a nonprofit. That being said, it is funded through donations. They have several fundraisers throughout the year. They have a big gala that's usually every April. They have a golf tournament as well that's sometime in the late spring. We have a Fam Fest that is usually every fall, usually in October. And those are just some of the big fundraisers. And we do have some smaller fundraisers throughout the year to allow these children to be able to attend this camp for free. It is completely free for the parents. They do not pay anything for them to come because we want it to be an opportunity for everyone to attend, especially the children that may not have another place to go, another camp where they are going to be able to be cared for in the way they need to in order to have such a great experience. Camp del Corazon isn't just based out of UCLA anymore. It has expanded tremendously over the past 2 decades. We have campers that have come from out of state, from Arizona, from places in Boston, from Florida. We've had campers that have come from Canada. We actually have quite a few that come together, usually fly on down. So really, we've gone international. During our virtual camp, we had campers that were from South America and Puerto Rico who joined us. And that was something really incredible and really special. And it really expanded our own volunteer counselors. Most of those campers, English was not their first language. And so we had a special section that was speaking Spanish to them during our virtual camp, and being able to provide something like that to them that they had definitely not experienced before is really unique. And it's fun to say that Camp del Corazon is now international. And one of those campers from Peru, I believe, did actually attend camp in person a few years ago. And it was just something that she was glowing about. It was such a great experience for her. I talked a lot about Dr. Shannon and Lisa Knight and their vision in creating this tremendous camp. Unfortunately, we lost Lisa a few years ago. She lost the battle to cancer. And with that, we definitely did not lose any hope in keeping this camp alive. Her daughter, Chrissy, or otherwise known as Penny Lane, really took hold of this camp. And while those are very large footsteps to follow, she has continued camp the way that her mother, Lisa, would want. She is out there as the face of camp and has been involved since her early 20s, so for several years herself. So it's really inspiring to see how Chrissy has really taken on the legacy of Lisa to continue this camp and continue with the attitude of, we can do this. How can we do this? We will do this. I know I've talked a lot about heart disease and how Camp del Corazon is here to support families of children with heart disease, but we have expanded and are including patients with pulmonary hypertension as well. In general, my clinical experience, children with pulmonary hypertension are seen by cardiologists. And that's one of the necessities for campers to attend camp, is to be seen by a cardiologist. And with our pulmonary hypertension patients who are seeing cardiologists, they're definitely welcome. And we're excited to have them at camp. As a nurse, I know that pulmonary hypertension is quite a debilitating disease. And we want these children who, again, don't really have a great place to go and be a kid, to be able to experience that and to meet other children who are similar to them, and to just have the opportunity to participate in activities just like any other kid. just like their peers. So as I've mentioned, Camp del Corazon could not be possible without donations from people like you. And so we really want to expand our community. And so FanFest fundraiser is Camp del Corazon's fall event. It's a 5K. It'll be some kind of like carnival games. It's really a way to join with the community. You can meet other people from camp, whether that's counselors or other campers and their families. So that's being held on Saturday, October 29th in North Hollywood Park. There's also an online auction if you go to the Camp del Corazon website that will be held the week prior, so October 22nd through the 29th, where you can find some really great goodies to bid on and help out camp to get more kids to camp. My name is Roslyn Rivera, and I'm aware that I'm rare.